Okay, thank you. So hi everyone. So together with me, Fredrik Flemming, as you can see in the picture, my colleague Jonas Fogelberg will do this presentation. It's on the topic of e-health in the Nordics, and we will give you an historical background, where we're coming from and where we're heading, and also we're going to introduce a case and present a case, and Jonas will cover the case. Both Jonas and I work at Telia, which is the equivalent to Deutsche Telekom, but in the Nordic and the Baltics. And we are targeting and focusing on the customer meeting, and the customer meeting appears everywhere, especially in the healthcare sector. So let's move on with the presentation, and let's see. Okay, do like this. So Swedish Healthcare in a nutshell. We would like to give you an introduction to what it looks like, and one challenge is that we have a geographical challenge in Sweden. Size-wise, we are almost as big or bigger than Germany, but the population-wise, we're just 10 million people living here. So Swedish healthcare is divided into a national, region, and a local levels. So we have 290 municipalities and 21 regions, and they do have responsibilities from a healthcare perspective, but different responsibilities. And the sections that we provide healthcare is close to home care, primary care from a medical center perspective. And then we have, of course, emergency care, elective care, inpatient care, outpatient care, specialist care, and also dental care. And in numbers, 10 million people are living in Sweden. Almost 12% of the BNP stands for healthcare, and in total, 812,000 people are working within the healthcare sector. So it's a big chunk out of the BNP of Sweden. And a lot of people are employed within the healthcare business. We have a high adoption of digitalization. So 41% of the inhabitants in Sweden have a personal e-service account where I can log in and look at my prescriptions and appointments with doctors. And healthcare is funded by local taxation to 71%, and the medical cost it's covered by the state up to 97%. So heavy subsidized, and this is in the social security of Sweden. That is the state that covers for healthcare. You don't have your own healthcare insurance. So from a historical perspective, back in the 80s, it was chaos. When I was sick, and my mother had to call to a medical center. She spent pretty much the entire day because it was busy all of the time. And finally, she got hold of a doctor or a nurse. And from a medical center perspective, they were chaos as well because they were always in phone, and the phones were constantly ringing, so they couldn't sort of attend to the business that they were set to do. So then in the 90s, a company came up with an idea. So let's introduce something that is called time slot callbacks. And it combined software and hardware and connected the phone with the computer. And at the time was revolutionizing sort of the availability. And so what is time slot callbacks? Well, time slot callbacks is this. You ring, you call to the medical center, and in this case, maybe for a test result, or you want to have a consultation. And then the system tells you that we will call you back at 1400. And at 1400, it's not 1400 now, so then you have time to do something else. You can sort of do anything else. And then at 1400, then the medical center called you back. So it has a high delivery percentage. So I would say that 98% of all the calls will be taken within plus minus 2 minutes out of this presented time. And then of course the callback time will vary depending on the queue. So this created a better availability for me as a customer to the healthcare or a patient, because I could rely that someone called me back. I didn't have to sit in the phone. And from the healthcare perspective, they now had a workload that used to look like this, but now look like this. So they could focus on what was important for them. So this increased, we went from chaos to organized status. And then moving on, then in the 2000, then a bank ID was launched by the banks, and that is a de facto authentication standard today. So that is very commonly used when you are authenticating yourself with banks, public governmental bodies, healthcare. You're logging into Telia, and it's a wide adopted version of identification. And it has, as it shows in this graph, in November 18, 2018, last November, there were roughly 300 million bank ID identifications in that month. And then take into consideration that the population of Sweden is 10 million. So in average, every inhabitant of Sweden identifies themselves at least once a day using the bank ID in some way or another. So it's a very important means of authenticating yourself, and it's not dedicated for a specific business. And then in 2003, 1177 was launched, and at that time we realized that it was availability was important, and until now we fixed availability from the medical centers. But now when people were sick out of opening hours, they went to the emergency center, and during the weekends was very hard to reach healthcare in Sweden. So then they realized, well, we need to be more available, and then they created 1177, which is a public contact center service providing healthcare by phone, and that increased availability. And then in 2010s, then video apps for healthcare was launched, and they were launched by private initiatives. Until now, the healthcare sector has been very much regulated by the state, and now private initiatives had the opportunity to offer healthcare services. And then there were startup companies that really shook sort of the business entirely, and we will come back to that later. And the ambition for Sweden is 2025 that we should be the world leaders when it comes to leveraging on digitalization for healthcare. Quite an ambitious sort of target, but that's the quest that we set out to do. So this is a short introduction of the history, and then let's look at some of the market players for the net doctors or the video doctors. And here you have some, and they are popping up by the day. And then you could ask yourself, who is using the internet doctor? And given the fact that Sweden is a very remote country, which is in the northern part of Sweden, it's not heavily densely populated, then you would assume that this would be the driver for the net doctors. But it shows up that sort of the ones that are using this are people within the 25 to 45 years old. They have parents with children. They are from Stockholm mainly, which is the capital of Sweden. And in total, sort of all these net doctor visits sums up to 1.5% of all the visits. So still not sort of a big part, but they are growing rapidly. So the one that started the first app was Kry, and they grew 1,600% just during 2017. And now, of course, now you can meet your vet using the same infrastructure, and also you can meet your psychologist here. And the driver why they are growing so fast is availability, because it's very easy and convenient for patients. You don't have to travel, you just download the app and then you are communicating with them. So making it very easy to get access to a doctor or healthcare medical staff. But that is a big problem, because this is very expensive, and if the projection is if this continues, it's going to be very, very expensive for the Swedish state. So now, just recently, 2 weeks ago, in the newspaper, and this is in Sweden, it was a big topic that they need to lower the reimbursements to the net doctors. And basically they are going down from 65 euro per call or contact to 50 euro, and you can see the numbers by yourself. And of course this really shook sort of the entire market, because then they said, well, you are not sort of making this profitable, and we are doing a great job for the patients in Sweden. Suddenly we are providing them with availability. So and the driver behind this, and the logic behind having a net doctor is of course what this man created, Napoleon, and he created Triage, and that is the key focus now in Sweden. And Triage is basically to analyze and understand who will survive if I give them some treatment, and who will not survive even if I give them treatment, and who don't need any treatment. And the reason is why it's so important to direct patients to the right service is, of course, a cost. Going to the emergency, depending on what you're looking at, you know, the cost for the state is 450 euros, and for primary care 300 euros, and 1177 15 euros, and self-service, of course, is 50 cents. So key is really to find out who should go to emergency, who should go to primary care, who should go to 1177 online, and who should go to self-service. And if sort of the state-owned healthcare hospitals and medical centers will not sort of provide good availability, then the net doctors will continue to rise, and it's going to be very costly. So I'm going to hand over now to Jonas, who will introduce himself and present you a case about a regional healthcare organization that has stepped up to the challenge, and this is what they are doing to keep up with the competition.
Thank you, Fredrik. Jonas Fogelberg here. I'm a product specialist, and the Region Skåne has been one of our clients in the healthcare area since many, many years. And as Fredrik has said, this new competition and new behavior we see in the market with how do you communicate with the healthcare sector will share some things that Region Skåne is doing to meet these net doctors. So briefly, Region Skåne serves around 15% of the Swedish population, and they also have a large contact center installation from us at Telia. So here are some figures. They are spread out at 500 patients today, and of course have a lot of inbound calls. And they also have some new kind of technology with some free speech bots and chat bots and robotics, etc. And a couple of years ago, they decided we need to compete with Kry and My Doctor and these. So they decided together with us to develop their own mobile app to increase the convenience and availability for the patients, of course. So I'll show you in the next couple of slides what this app does. So it has self-service for booking your appointments. And as Fredrik talked about, what they're adding to this mobile app shortly is the triage function, which will see that you will meet a doctor in those cases when it's needed. Otherwise, you might talk to a nurse or someone else. It handles today inbound calls, callbacks, and video, and it also has a little survey afterwards. And some of the benefits are, of course, from the healthcare perspective, that their staff can mix with inbound calls. We talked about the time slot calls as well, and callbacks and video in one common queue. And this actually creates a greater productivity, and also these drop-in video meetings combined with book meetings allow for a better staff allocation. And staff, of course, nurses and doctors are the most the biggest chunk of the costs when it comes to meeting patients. And of course, I'll come back to the some benefits later on, but of course, patients appreciate, for example, to have a repeat meeting via video instead of having to travel to your local medical center. So let's take a closer look. So in this app, this is in Swedish, but in this case, you can see what appointments are available if you want to book a meeting, perhaps next week or something like that. Of course, this app will remind you if you have a booking, it will remind you the day before, etc., and an hour before you're going to your doctor's appointment or whatever it is. But the new thing here is the triage function, which everyone has realized is important. You cannot meet the doctor right away, as Fredrik showed. That's a very expensive way of doing it. Therefore, you have to go through a couple of questions in the triage. So actually, you're meeting a sort of a chatbot here in the beginning, and show you a quick example. It's in Swedish, but here I'm writing, well, I have some sort of bite on my arm or my leg or whatever, and the bot responds, is it any one of these? And I click it, and I'm asked to describe my problem in more detail. I had some options there, and when I clicked this option, that I said, okay, it will recommend the triage level. Shall I go to the emergency, or should I go, in this case, it points to, okay, you need to book a meeting with your local medical center. Or could you call the 1177 and they could guide you, or in green on the left, they can provide you with some advice online on how to treat this yourself. So this is a triage function, which is really beneficial. But in this case, then, let's say I want to book a video call with my medical center. So we'll just have a quick look how this works. So I click the meeting is up. I'm clicking coming into waiting room, waiting for the nurse or the doctor, and then they log on and we start the conversation. So, well, here are the benefits, of course, when a doctor or a nurse and the patient can actually show something. Here's, I'm wondering, what's this? And can show more with your mobile phone, of course. So video in this case, of course, adds some value to make an assessment. And afterwards, of course, you can fill out a survey. And some of the benefits, coming back to that, which have been communicated, is that many patients are disabled or have problems transporting themselves to the hospital or medical center, and for many of them, it's usually the elder population. It takes them an entire day to do a single visit. And of course, with Region Skåne, they can easily help patients with things like adjusting equipment, like glasses, as you see here in the slide, through video, or hearing aids, and they can conduct various follow-up meetings through video, or I mean a phone call, or they can actually often use language interpreters as part of the conversation or a video conversation. So there are many applications of this, and of course benefits. And what do the patients say? Well, of course, they're happy with not having to travel to your medical center in case it's not important. But the most interesting thing that we have seen, and the patients are saying, is that they feel more comfortable talking in the privacy of their own home. So actually, we see that these meetings will be better for both the patient and the healthcare in that case as well. So that's an interesting finding. Okay, so to summarize, what we are doing is trying to support the entire process from booking an appointment. We saw the triage. It can be, and you can receive a verification online or email or an SMS, or you can talk to a chatbot. You can use any type of channel actually to book the appointment. And when it's time to actually have the meeting, these systems can, of course, search for the best available person within Region Skåne in this case. And the meeting can be through video, as we've seen here, but of course you can use phone or chat, and also you can share a screen with the customer, perhaps showing them some data or pointing out to some interesting articles on the web, etc. And of course, being able to follow up all of these meetings with surveys and perhaps do some recordings to improve your healthcare meetings. And of course, for the management, they can administrate this entire process and follow this up through dashboards and so on. So that's the case of Region Skåne, Fredrik. So I will hand over to you.
Yeah, and let's do some key takeaways in the summary.
Yeah.
And we will open up for questions shortly. And eHealthcare is growing rapidly, as we have presented in the Nordics, Sweden.
Yeah, I've heard someone comment earlier here when we visited some conferences in Germany that they're saying, well, it seems like Sweden is like 10 years ahead of the German market in many ways when it comes to e-health with these new type of tools and ways of working.
Yeah, that's. I think that's true, and of course that sort of is giving traction to the ambition of the Swedish state to be the world leaders in 2025. And then another key takeaway is that video and mobile apps adds value for patients and healthcare, as Jonas just outlined. You know, not having the convenience of sitting in your own home from a privacy perspective, and also not having to travel. And of course, from a healthcare perspective, suddenly adding the opportunity to be more available and keeping up with competition with these net doctors visits.
Yeah, and you have used the net doctor yourself, Fredrik, and
yes.
You were with the experience.
Yeah, I would say it took me like 5 minutes.
Yeah.
The whole onboarding process from not having anything installed on my smartphone to having everything installed, fixing the payments, and talking to a doctor and getting my prescriptions. Very convenient.
Yeah.
And I wouldn't have even made it to the bus within 5 minutes just going to a medical center.
Yeah.
So I think it's a very good example.
Yeah.
And
yes, and we talked about patient satisfaction, as we said, not having to travel is of course, and the convenience that you talk about, Fredrik. And as I mentioned, one interesting finding is the patient feels more secure in their own home, talking about their problems, which is a great benefit for everyone actually. So, but the downside, as we talked about, is of course the increased costs with all of these net doctors, where perhaps just for a cold or a symptom or something, you talk to a doctor directly. That is not the triage way of doing things, really, the most cost-efficient way. So.
No, but then you could have, if you have maybe you have a cold and you want to book a follow-up meeting, and then suddenly you have a process to give exactly the same sensation as a physical meeting, but now from a digital meeting. And I would say, lastly, as we mentioned, I think sort of triage is important. That's the only way to be cost efficient. And that would be our key takeaway and our summary. And now we'll open up for any questions, if there are any.